Hi, good day to all of you. Today we are going to see another topic in cardiology, infective endocarditis. So first we'll be seeing about this infectious disease, followed by other valvular heart diseases we will see subsequently. So infective endocarditis, before we are going to deal about infective endocarditis, I want you to know about what is endocardium, what is myocardium and what is epicardium. So all of us would have learnt that the heart has three layers in anatomy. So the outermost lining of the heart, which is formed by the pericardium and connective tissue, adipose tissue, that is called as the epicardium. It contains nerves and blood vessels which are going to supply the surface of the heart. So epicardium. The muscle mass of the heart is what we call as the myocardium. So this is the myocardium. This myocardium is what is going to get affected in case of your acute coronary syndromes or in case of your cardiomyopathy. And then we have the innermost lining, which is your endocardium, the myocardium. So endocardium consists of the valve, the cusps of the valve, the chordae tendineae which are going to attach the valve to the wall of the myocardium. So endocardium basically involves the valve, the cusps of the valve, the chordae tendineae which are attaching the valve to the myocardium. So if any of this is getting involved in an infectious process and getting inflamed, then that is what we call as endocarditis. There are certain non-infectious causes also which can inflame these structures, and then it is called as non-infective causes of endocarditis, which we will be seeing in the subsequent slides. So first, pathophysiology, to understand what happens in infective endocarditis. There are vegetations or solid masses which are going to get formed and going to get attached to the structures that we described as parts of the endocardium. What are these vegetations? They are nothing but masses of multiple platelets which are embedded in a fibrin, and in case of an infective endocarditis, there are multiple microorganisms present in them, and there are some inflammatory cells which have come to attack these microorganisms. So you have neutrophils, for example, you could have monocytes, and you will have platelet aggregates, fibrin, bacteria. So all these together will form a mass which we call as vegetation. So this is useful in diagnosis of infective endocarditis. These vegetations can be found on heart valves in case of a structurally abnormal valve mostly, and in case of a ventricular septal defect or a congenital heart disease or any other structural abnormality, the low pressure side of that structural abnormality, you can see such vegetations getting formed. This is due to change in the force and velocity of the blood which is falling on the low pressure side. That will generate certain endocardial damages on the low pressure side of these defects. Thereby, a clot can form over that area, platelets can aggregate over that area, and then this is what we call as non-bacterial thrombotic endocarditis. A clot is formed over an injured endothelium. So this endothelium which is normally there gets injured due to the force of an abnormal flow of blood, and this injured endocardium becomes susceptible. Since the tissue factor is going to get exposed, you have a platelet fibrin thrombus which is going to get formed over here. But initially there will be no bacteria here. So it is called as non-bacterial. And since a thrombus is formed on the endocardial surface, it is called as non-bacterial thrombotic endocarditis. So this is the first inciting lesion in case of endocarditis. Later on, over this non-bacterial thrombotic endocarditis lesion, whenever there is a systemic infection which the patient can develop, bacteria will keep going around, and these bacteria can come and get attached over this lesion, causing infective endocarditis. So this is how infective endocarditis starts. The most common sites will be commonly heart valves, low pressure side of structural heart diseases, mural endocardium which is damaged by aberrant jets of blood, foreign bodies or intracardiac devices. Foreign bodies in the sense like in case of valvular heart disease, we implant artificial valves in patients, prosthetic valves. So these prosthetic valves can be considered as foreign bodies, or intracardiac devices. So intracardiac electronic devices are used for treatment of multiple conditions. These can get infected and cause infective endocarditis.